All right, Miss Jayleen. So you said you coming in today for an appointment. What was going on?
I'm just here to get checked, cause I'm just trying to see if this man gave me the clap on a handstand or if he gave me something worse than a clap. Okay.
All right, man, I'm gonna get a man
Okay.
cave before you go upstairs, bro.
Can I get your ID real quick so I can check you into the system?
Yes, sir. Hold on.
Let me get a man cave, bro. Appreciate you.
Okay. So first, real quick, the reason for your visit is just because you want to make sure that you don't have any type of sexually transmitted diseases or anything like that.
Yes, sir.
Okay. Let me see real quick. First, before we get started, my name is Dr. Freddie with the General Glendale WMSA. I understand that you're here today for the thought of just checking to make sure you're good. Um, can you describe to me or tell me if you've had any symptoms, if you've been feeling any symptoms, and if so, how long have they been occurring?
Oh no, I don't got no symptoms.
Okay. You just want to make sure.
Yeah, cause I don't want my baby coming out and then my baby they end up telling me, oh well, ma'am, it it look like you got the clap. You can't give birth to the baby naturally. You get what I'm saying?
Okay. Real quick, I'm gonna check your blood pressure. Just be real still for me. Okay, everything there seems to be good. Let's check your heart rate real quick. Your heart rate seems to be a little elevated. It could be normal in some of these cases. Just for the thought of, you thinking that it could be something. So that could be a reason why you have, a little bit of an elevated heart rate. Your temperature seems to be normal. It's reading at a normal level. Um, okay, so now we're going to go over your medical history. I know you're pregnant, and you are, again, how many weeks?
I can't even tell you.
You don't know how many weeks?
Fam, all I know is I'm a couple days from giving birth. That's it.
Okay.
That's all I know.
So you're like 37 and 38 weeks?
38 to 39.
Okay, understandable. Um, so you said you have no symptoms, so you don't have no symptoms such as burning during urination, vaginal discharge, itching, pelvic pain, sores or bumps or bleeding.
Oh, no, sir.
Have you ever had any previous STIs?
No.
Any allergies?
Yeah, chocolate and dark soda.
No, I said any allergies.
Yeah, allergies. I just told you what I'm allergic to.
No, not what you're allergic to. Like any allergies, like sneezing, coughing.
Oh, no.
Okay. What about any current medications? What medications are you currently taking?
Um, Prenatals.
Okay. And you have no medical conditions?
No, sir. I mean, besides me being pregnant, that's a medical condition, right? That's a big one right there.
Okay. So real quick, um, I'm gonna give you an IV. I'm gonna come in here real quick. I'm gonna stick you with an IV real quick, get some blood, and then I'm also gonna let you have a urine test.
Blood. Oh, Jesus.
Okay. I'm gonna do your left arm real quick. Okay. That was a success. First try. Let's pull some blood. Oh no, you're okay. It's okay. It's okay. Wake up. You're good. Apply some bandages. Okay. So I'm gonna run this through the system real quick, and I'm also gonna give you this urine sample cup. I'm gonna let you urinate real quick, and then I want you to call me back inside the room when you're done. Okay? Oh no 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 no! Get up, get up, get up. Are you okay? Excuse me, Miss Jayleen. Hey. Excuse me, Miss Jayleen.
Huh?
Okay. All right. You okay?
Yeah, I just get a little woozy whenever I see blood.
Okay. Okay. Well, there's no more blood. Um, there's no more blood. I bandaged it up, so there's no more blood. I just gave you this urine sample cup. I want you to urinate into this cup. I'm gonna step out the room real quick. Just call me back in the room when you're done.
Okay. You can come in.
Okay. Okay. Let me see the urine. Okay, give me 1 second. Let me run your blood and your urine through the system. Okay, real quick while that's going, I'm gonna explain a couple things to you. So, I'm gonna tell you how infections can affect the pregnancy, especially if untreated as well. So, some sexually transmitted infections can be passed to the baby during pregnancy or delivery. They can affect the pregnancy themselves, and the effects just depend on the specific infection. So, some examples include like chlamydia. It may increase the risk of preterm birth. The baby can develop eye infections. The gonorrhea can increase the risk of premature rupture or membranes and preterm delivery. And a baby exposing during birth can develop a serious eye infection. Syphilis can pass through the placenta during pregnancy and may cause miscarriage, stillbirth, premature birth, or serious health problems for the baby if untreated. HIV, without treatment, HIV can be transmitted to the baby during pregnancy, labor, delivery, or breastfeeding. Modern treatment greatly reduces the risk. Hepatitis B can be passed to the baby at birth, but newborn treatment and vaccination can significantly reduce the risk. Herpes, if active genital sores are present during labor, the baby can be exposed during vaginal delivery. In some cases, uh, A C-section birth may be recommended to reduce the risk. Um, how to prevent STIs: using condoms or other barrier protection during sex, even during pregnancy, to reduce the risk of many STIs. Limiting the number of sexual partners. Being in a mutually monogamous relationship where both partners have tested negative for STIs. Getting tested promptly if either partner has symptoms of a possible exposure. Avoiding sexual contact if either partner has active genital sores or has been advised to avoid sex until treatment is complete. Keep all prenatal appointments since routine screening is part of the prenatal care. Um, just to make sure you have safe sex during pregnancy, we'll be using condoms. If there's any risk of STI exposure, avoiding sex. Huh?
I won't be doing none of that. Mm-mm.
Okay, okay. Um, so that's good if you're not having any sex or anything like that. Um, when the treatment, okay, so while completing treatment is important if an infection is found, um, taking all medication exactly as prescribed helps clear the infection. Stopping treatment early can allow the infection to persist. Untreated infections can continue to affect the pregnancy and increase the risk of complications. Some infections require a repeat test after treatment to confirm they have cleared. The patient should attend any recommended follow-up appointments. So real quick, I think everything just came back. Give me 1 second.
I promise you, if this man gave me something, I'm going. That's all I'm gonna say.
Okay. Oh, okay. It looks like you do have a sexually transmitted disease. Let me see which one it is. I'm gonna go down the list.
I know you. I know. Don't. So, this ain't give me the. Oh! I want to call it so freaking bad.
Oh, it looks like.
Oh, hell no. I know you lied.
Oh my God.
Oh!
Hold on. I gotta go down the list. Oh my God. Hold up. Oh my God.
What?
Oh my God. Wow. Hold up. I've never seen this many on a test before. Hold on.
Fam, you gotta run that back. This don't make no daggone sense. Hold on.
Oh wow.
No. Wait, hold on. Let me. Hold on. Nope.
Oh my God. Wow. I've never seen this many come back on the test like that before. Okay, real quick, let me go back and look at the. Let me re-get the results real quick just to make sure that this is all
Okay.
correct.
Because this don't make no freaking sense. If this man really gave me all of that, like I should have been like this is what I freaking get. Like this is what I get. God made an example out of me. He told me not to be, having sex outside of marriage. And look at me. I know all the guys had sex. I got pregnant. And now look at I can't do this.
So look, come here, Miss Jayleen. Come here. Calm down. I'm finna reread down this paper. Maybe the first paper came off false, but let's see what it gives us. Okay, so you do have gonorrhea. You do have chlamydia.
We got people shooting at us. We're finna go kill people right now.
Okay, so you don't have HIV. You do have syphilis. You don't have hepatitis B. But you do have hepatitis C.
What side?
So hepatitis C, just so I can tell you correctly. Hepatitis, 1 second. So basically, hepatitis C is a virus that infects the liver. It can cause inflammation, swelling, and if left untreated for many years, may lead to liver damage, cirrhosis, liver failure, or liver cancer.
How is that an STD?
I tested your blood for all possible any type of diseases. So this is everything that came back.
Oh, well, I'm still gonna be. Is everything? You know what, baby? I need you to stay up in there a little bit longer because until Mama clear this up.
Yeah, so it looks like that's gonna be the best bet. Just making sure you can clear all of that up. I'm gonna prescribe you the right medications and things like that you need. I think it may be beneficial for you to bring your sexual partner, whoever the dad is, into the hospital.
He was here yesterday.
Yeah, he needs to get treated. He needs to get treated. He needs to get tested as well. I want to also schedule you for follow-up testing. We can have you come back tomorrow, or you can meet with your OBGYN to reschedule. I'll make sure I send everything to her and let her look over everything so she can retest you. And I just want to monitor your pregnancy for any complications related to the infections. But I'm going to leave that in your notes when I speak with your OBGYN. Come with me, please. Have a seat on the white couch for me, please.
This nigga done gave me hepatitis C, gonorrhea, chlamydia, and syphilis. Wow.
Hepatitis C might be something to do with yourself. Not too much as a sexually transmitted disease, but gonorrhea, chlamydia, and syphilis are definitely some forms of STDs or STIs.
Wow. That's like dead in my. Wow. First time I give it up, I get pregnant. Boom. Right before I give birth.
So one thing I want you to do is watch out for a couple things that need urgent medical attention, as far as things like abdominal pain, heavy bleeding, fever, leaking fluid, or decreased fetal movement. I want you to look out for these things. I'm going to set you up for an appointment with your OBGYN so that way she can get in contact with you. That way y'all can get together and she can retest you and go over things that you need to do as far as steps that you need to take. I'm going to prescribe you some medications today so that way they can try to slow down the process. This treatment will be best for you, and also your OBGYN will be able to go a little bit more into depth on everything. Give me 1 second. I'm printing up your discharge papers. At this time, you are free to go. I would like to see you for your follow-up appointment in 2 weeks. Please see the front desk for your next appointment, your discharge papers, and your take-home medications. But before you leave real quick, could I see your insurance card that way I can run it through the system?
Oh, boy, I don't got no insurance.
You don't have insurance?
I don't think so. You got that?
Yeah, there was an insurance.
What was that?
Your CS certificate. That's your work history. Okay. Alright, everything came back good in the system. I'm going to follow up with your OBGYN and let her know everything that took place today. So just make sure you come back on your desired date that will be set. Your OBGYN will be contacting you with further notes and letting you know when your appointment will be scheduled.
Thank you.
Thank you so much.
Just don't make no damn sense.
Alright, don't forget to stop by the front desk to get everything. Huh?
You telling me I've been having this my entire pregnancy? I only had sex with this man once.
Yeah, that's how. Yes, ma'am. That's how STIs and STDs work. They may lay dormant to where they might not show up at some points, but yes, ma'am. It looks like you have had all of these things your entire pregnancy.
Wait, so I have a STI or STD?
You have STIs, but you also have a STD.
So that STD I can't get rid of.
The syphilis and the hepatitis C are forms of STIs. But I want you to note that we can try to treat everything and get rid of it. Just I will have you speak with your OBGYN so she can go more into depth on everything.
I'm finna kill myself.
No, don't do that. Don't do that. Just stop by the front desk, pick up your medication, your discharge papers, and then from there, we'll discuss further treatment.